Hi, I'm Daniela Worth. I'm a doctor of physical therapy, and today I'd like to talk to you about whiplash. First of all, if you find this information helpful, please like and subscribe to my channel, as this will help the search results come up more easily for others who are searching for this information. Whiplash, in my opinion, is one of the more undertreated and underdiagnosed conditions in the PT clinic. What commonly happens is that someone will get into, say, something like a car accident or maybe crash their bike. Usually it's a car accident, but it can be other things as well, where they will sustain a whiplash injury, which means that you're moving forward and all of a sudden you stop. And so your force continues forward and you get a rapid stretching of the muscles in the back of the neck. This causes almost immediate trauma to those muscles and they start to atrophy. We start to see, if we do an MRI, for example, we'll start to see very rapid, what we call fatty infiltration of the muscle, which just means that we are literally losing muscle and replacing it with fat, which means that it's not going to be as strong, it's not going to support us as well. This is bad. This can be prevented very easily. So what happens if it's not treated is that you'll start to see a decreased range of motion, so people won't be able to turn their heads as well. I've seen people come in and they are here. They can't turn their heads side to side as they should be able to. They can't go up and down. They're feeling a lot of pain. They start to feel like they have what I would call a newborn neck, which is when they go to sit up from a chair, they feel like they just can't support their neck and they need something behind there for support. Now, that is a more severe case that's untreated for a while, or if someone sustained multiple car accidents in a short period of time. Typically, people don't get so bad that they have what I call the newborn neck. But again, it's possible, and that can be the path that is taken. So, how do we prevent this? What typically happens is someone will be in, let's say, a car accident. They get an x-ray. The x-ray shows you're good, you don't have any fracture. That's great. However, it doesn't mean that your soft tissues are okay. And it doesn't mean that they're not traumatized. It doesn't mean that the process hasn't started. And so what I recommend to everyone is, if you have been in a car accident, especially if it was high speed, go to physical therapy. If you're not having any problems, great. Go to physical therapy. They'll give you a couple of things to work on to prevent the fatty infiltration of the muscle from beginning in the first place. It is much faster treatment and it is so easy to prevent versus if it goes on for a couple of months, which is typically what happens. It will go on for a couple of months because they're told, by the x-ray technician and the physician and the ER, hey, you're good, no x-ray findings. And so they'll go on about living their lives. And then a couple months later, they realize, hey, my neck has been messed up and it's been getting worse and worse and worse. It hasn't been getting better. And that's usually when they come and see me. We can stop this. We can stop this early on. So here's what you can do if you've been in a car accident. First of all, you want to activate the front muscles of the neck. These are the deep neck flexors. They're not the muscles. They're not those muscles. These are muscles that are very, very deep in our throats. So you're going to perform a chin tuck, which just looks like this. You're going to act like you're giving yourself a double chin. It's a subtle movement. What I tell patients is, you may feel a gentle stretch back here. That's good. You may feel like you're giving yourself a deep ache, like a little sore throat. That's also good. That means you're doing it right. The thing that we don't want to see is, okay, so picture a pen is sticking out of my ear. When I do the chin tuck, if I were to have the pen on a piece of paper, when I take the pen off of the paper, I'll see just a dot, the way it moves, versus a rainbow or a line. So here's the rainbow, and here's the line. We don't want to see those things. It's a very small, subtle movement. That's number one. Number two, you're going to take a band, bring it around the back of your head, It doesn't matter too much what the resistance of the band is, okay? Just a little bit of resistance. And you're going to give yourself some pull here so that there is tension on the band, and you're going to perform a chin tuck. So there you go. There are two huge things that you can do that will make a major difference in preventing atrophy of these really important tiny postural muscles that we have in our neck. These muscles, again, get traumatized when we have a car accident, and we can easily prevent this. So I hope this was helpful. Let me know in the comments if you have any other questions or if there's anything else I can clarify for you. And again, if you find this video helpful, please like this video, subscribe to my channel. It will help everyone find this information faster. So take care.